Welcome to HGH.TV, your premier source for all your hormone replacement needs. We specialize in doctor-monitored human growth hormone, testosterone, Sermorelin, and HCG diet therapies, with pharmaceuticals prescribed with USA pharmacies by board-certified physicians. A safe and responsible choice in regaining youth and vitality back in your life with hormone replacement therapy. Up next, we have some helpful information and tips for your hormone replacement therapy.
In front of me, we have your complete testosterone therapy program. These are typically the 3 medications of any doctor-monitored protocol: testosterone, HCG to be taken during and after your testosterone therapy, and Arimidex. These are oral caplets to block excess estrogen buildup and are taken after each testosterone shot. Consult your prescribing doctor for exact dosages and protocols. Here we have your typical vial of testosterone. The most popular and the most prescribed is testosterone cypionate. The bottle normally comes in a tinted vial to protect it from light. They come in an oil-based form. Like always, we never promote any particular type of testosterone or promote any specific pharmacy, so that is why the vial we use has no label. Here, you will notice the rubber stop is sealed with a protective cover. When you first receive your testosterone vial, these types of packaging are the most popular you will encounter, especially when purchased through a compounding pharmacy. So to remove it, simply dig out the metal seal with your fingernail, like so. Once it's removed, it reveals a rubber stopper. The size of the vial may vary. Today we're using a 10 ml vial. Of course, testosterone does not need to be refrigerated and requires no mixing. However, keep out of sunlight and keep at room temperature. Now, you will need a thick needle such as this 18 gauge 1-inch needle pin in order to withdraw the thick oil-based testosterone for injection. Some clinics and pharmacies may offer the 20 gauge 1-inch needle pin to withdraw with. Either the 18 gauge or the 20 gauge in any length size should do just fine. Always make sure that the packaging is untampered with before using. Now, this is a 23 gauge needle here, pin. They all come in protective clear covers. Now, this is a 25 gauge 1-inch needle pin. Now, this is the actual size of the needle itself, 1 inch. This 1-inch needle is typically used for arm injections. The 25 gauge is a thinner needle that goes into your skin easier than the thicker 23 gauge needle. Here's the 25 gauge 1.5 inch needle. Notice the length on this one. This is a longer needle and is used typically for your buttocks area of the glutes. And this is a syringe tube you'll need to withdraw the testosterone. This one happens to be a 3 ml tube, which is most common for HRT programs. You will use the appropriate size needle, just like the one that you see here, and attach it to the syringe tube by screwing them together. The cap here unscrews, allowing you to combine the two pieces together, like so. Here we have the testosterone vial. Once again, remember to have the protective metal seal removed before you proceed. If you receive it without a seal, then you know it's already been opened. Always make sure that's in place. Now, you'll need a thicker 18 gauge or 23 gauge to withdraw the thick oil-based testosterone. This 18 gauge is usually the most effective at withdrawing the medication without as much effort. The 20 gauge will do the job also. However, you may notice a slight difference in how it withdraws the testosterone. Now we're ready to withdraw the testosterone. So we're going to connect both the syringe tube and the appropriate pin needle. Remember, this is for withdrawing only. You will not inject yourself with this size needle. You will be using a thinner gauge needle for that, which will replace the one used to withdraw. Now, we reviewed the supplies needed for this first step. Now let's focus on withdrawing testosterone from its vial and prepare for injection. This will be what you'll need to prepare for testosterone therapy injection. It's extremely important to make sure your area is clean and sanitary. Use alcohol swabs on anything that comes in contact with your fingers. Once we remove the metal seal to the testosterone, the rubber tip should be wiped down. Make sure when you handle it with your bare hands, you do not need gloves for this. Now, pick up a box of swabs at any local pharmacy, tear open a package, wipe down the tip with just a light dab. No need to saturate the area with alcohol by pressing hard. A little touch will do just fine. Dispose of the swab. You might find that your medications come with a package that has the needle and syringe already combined in a syringe kit. The needle and syringe tube are already connected. Again, it depends on your clinic and pharmacy on how you receive it. However, typically these are sent with HRT supplies that require a one-time mixing with water into a powder-filled vial such as HCG or HGH. So let's start with a 20 gauge 1-inch needle. This is a thicker needle and is only for withdrawing, not for injecting. Open the package like so. If the package for whatever reason has been tampered with, just place it back inside and discard it. Discard it if it's been used. Take it out, put it back in and discard the packaging. Now that we have the needle pin out, we can set that down and reach for the syringe tube. Also easy to open. Again, if it's been opened already, just dispose of it and grab another unopened tube. Again, if it's been tampered with or opened, simply put it back in its packaging and throw it out. The cap needs to be unscrewed and taken off. Very easy to do. Take off and to place back on. Like so. Now, grab your 20 gauge needle, pin, and screw it. The two pieces fit together. Very simple. On or off, just twist on gently, not too tight. Once you are ready to proceed and you don't anticipate any interruptions, take off the protective cover. Keep this handy just in case. We can now withdraw the testosterone. Again, we are using this size needle because it will be easier to withdraw the thick testosterone through this needle. Insert the needle dead center as possible, as best you can, into the rubber stopper. Try and go in as straight as you can as to not bend the needle. Now withdraw the testosterone slowly with both hands. Right, now our goal is to withdraw 1 ml. Since the entire syringe tube is 3 mLs, be sure not to end up with an amount that nearly fills the entire thing. That's way too much. Now we can take it out and we are now ready to switch needles. Again, we are not going to be injecting with this size needle under any circumstances. Pull on the needle slightly to get any extra testosterone out from the needle. If not, some will be wasted in the shaft of this large needle pin once we unscrew it and dispose of it. If for some reason you need to stop everything, just grab the needle cover, replace it carefully, lightly screw it back on, like so. Very simple. Put it away. Now let's say you threw out the needle cover and at this point you get interrupted. Instead of reaching for the already disposed needle, simply use the syringe tube cap we kept handy and replace it, like we have here. Set it down and resume the injection administration when you're ready. Once you are ready to proceed again, pick up the syringe tube, make sure and pick the right needle pin to insert. You may need to recap the syringe tube just to have things all ready, so always keep that cap handy. Find the right syringe, needle tip combination you'll need. Set that down. Grab the correct size needle pin for injection, whether it's the longer needle for the glutes or the shorter length needle for the arm. Open the package. We have the 23 gauge needle here. Be careful unscrewing and screwing the cap. You don't want any testosterone to spill out. Screw on the needle pin. Take off the cover. You may have some air in the tube, so very slowly push in the plunger until you see a small drop appear at the end of the needle. Do this very gently. And here you see a small drop of testosterone. Flick that off, and now you are ready to inject yourself with your medication. Consult your clinic or physician on the exact dosage amounts prescribed. You should not hesitate to get assistance if anything is in doubt. Once again, if you have the needle cover handy and you are interrupted, then just replace it until you are ready to proceed. Like so. It is not recommended that you keep any injection medication in this container for an extended period of time. We've just completed the preparation process of withdrawing testosterone for injection. Next time, we'll discuss the best way to inject your testosterone therapy according to your needs and lifestyle. See you next time.
We hope you enjoyed our segment. For more information, contact one of our representatives here at hgh.tv. And remember, this instructional video is not intended to replace the advice and direction of your current healthcare provider. This video presentation is about health issues, but it is not medical advice. If you're seeking specific medical advice or assistance, you should contact your personal physician. Also, the material discussed in this presentation is not intended to present the only or necessarily the best method and procedure, but rather presents the opinion of our experts. You can look forward to more informative videos right here on hgh.tv, your hormone replacement specialist. Glad you can join us. We look forward to having you back here real soon. Bye for now.